So this is our lecture 1, which is about history of the pharmacology, ancient history and modern history. Ancient history start with India, which has 6 systems of medicine that comes under Ayush. Out of this Ayush, this Ayurveda is the most ancient one, and it had its origin about 5000 years ago. Then this Ayurveda history is further divided into prehistory and the real history. Prehistory, in this history, some points are about mythology and some are from their rishi to their pupils. But the real history is the written history, which is documented in the form of some papers or other object. So in India, Vedas are the documented or written history of the Ayurveda. Where in China, this is Pensao. In Egypt, there are 2 paper, Kaun or Eber's paper. So first we'll see the prehistory, which is oral, unwritten or mythological. So mythological history started with the god of Hinduism, that Lord Brahma passed its all information or knowledge to the Daksh Prajapati. Then from Daksh Prajapati, the information passed to Ashwani Kumaras, which were the twin brothers. Then from that it passed to Lord Indra. So up to this, from God Brahma to Indra, this is known as the divine or mythological origin. Then there were 2 main schools of thought. One believes that it was the Bhardwaj Rishi who first got the knowledge of Vedas or Ayurveda from the Lord Indra and passed to the Rishi Atreya. But in second schools of thought, they believe that Dhanvantri, which is also known as father of Ayurveda, they believe that Dhanvantri had 6 disciples, and here Atreya also had 6 disciples. So this is the system, or these are 2 schools of thought. One is according to Bhardwaj or one is according to Dhanvantri. In this system, oral or unwritten history, the knowledge or information was never recorded. All the information was passed from teachers to their student. So for example, this is the Rishi Atreya, who recites Veda or other scripts in front of his 6 disciples. And these pupils or student, they remember and recall the information whenever they required. Similarly, Dhanvantri also had 6 students, out of which one student named Susrut had written this documentation in the form of Susrut Samhita. And in case of Rishi Atreya, which had 6 students, out of that only 2 students, Agnivesha, wrote Agnivesha Tantra, and the student named Vela had written Vela Samhita. So in this way, Atreya and Dhanvantri both had 6 disciples. And in these schools of thought, this is the origin of Charak Samhita, and this is the origin of Susrut Samhita. So in origin of Charak Samhita, it started with Bhardwaj, then information passed to Atreya to 6 disciples. Agnivesha wrote Agnivesha Tantra. This Agnivesha Tantra, it was edited, refined or redacted by Charka. and after that this is known as Charak Samhita. And in case of this Dhanvantri disciples, which is known as Susruta, whatever was documented, it was known as Susrut Samhita. So this is the ancient history. One is unwritten form, and here is the documented or written history. So from these schools of thought we comes with the Charak Samhita, and here we come with the Susrut Samhita. So from this history we come with Charak Samhita, which was written by the Rishi Charak, and Susrut Samhita, which was written by Susrut, and there was one more, Vagbhata. Charak was a physician related with the medicine, and Susrut related with the surgery, and the Vagbhata was both physician as well as surgery. So out of these three, Charak Samhita is the oldest Ayurvedic text. Charak Samhita is the oldest Ayurvedic text. These three, Charak, Susrut and Vagbhata, these three are known as great or grand masters of Ayurveda. Great or grand masters of Ayurveda. And these three written material, these three books, Charak Samhita, Susrut Samhita and Vagbhata, book's name was Ashtang Hridaya. So this was the book written by Vagbhata. So these three books are known as primary text of Ayurveda. Primary text or secondary text of Ayurveda. This is also known as Brihat Trayi, and this secondary text is also known as Laghu Trayi. So from the mythological or the oral history, we reach up to the text of the Ayurveda. They are divided into two parts: primary text of Ayurveda, secondary text of Ayurveda. Primary text is also known as Brihat Trayi, Great Triad, which are known as Charak Samhita, Susrut Samhita, Ashtang Hridayam, which was written by Vagbhata. Similarly, there are three secondary texts of Ayurveda, which are known as Laghu Trayi or the Lesser Triad, which is Madhva Nidana, Sringdhara Samhita and Bhav Prakasham. So these are the text of Ayurveda, primary and secondary. So after prehistory, we'll go to the written history or the documentation. That is, in India, Vedas are the oldest text. Vedas are the oldest text. There are 4 Vedas, that is Rig Veda, then Yajurveda, Samveda and Atharva Veda. These four Veds, they are again divided, or each has four components. And the components are known as Samhita, that is the text. The Samhita is the text, and so Vedas are the oldest text, and there are four in number. Each Veda is composed of four parts. One is the written text Samhita, Brahmanas, Upanishad and Aryankas. And these four Vedas, they are further divided into four Upaveda. And in case of Upaveda, the most important is the fourth Veda, that is Atharva Veda, which is having Upaveda Ayurveda. That is your science of life. According to Kashyap, this Ayurveda is regarded as the fifth Veda. And in some literature, this Ayurveda is a Upaveda of the Atharva Veda. So these are the oldest documentation, written history of Indian system of medicine, that is the Vedas. Four Vedas, each divided into four component, and they are further into four Upaveda, where Atharva Veda is having Ayurveda as its fourth Upaveda. But according to Kashyap, it is also known as fifth Veda. Summary of lecture 1. The history itself divided into ancient and modern. Ancient history, as it was mythological, that is related with the god, and one was written. From written, we end up with Vedas. They are 4 RYSA, and this last one is having Upaveda known as Ayurveda. And from this mythological or oral history, we come with primary text and secondary text of the Ayurveda, that is Charak Samhita, Sushrut Samhita and Ashtang Hrityam. It was written by Charak, written by Sushrut and written by the Vagbhata. So this is the summary of lecture 1.